construction activity to resume in Philadelphia on Friday, May 1st. I am issuing an executive order detailing the additional limitations for construction in Philadelphia in light of the governor's order allowing resumption statewide on Friday. For example, no work is permitted within any occupied dwelling unit except emergency repairs. Work can only take place between 7 a.m. and 5 p.m., Monday through Friday, except for emergency repairs. Each contractor must appoint a pandemic safety officer who must obtain a COVID-19 training certificate from OSHA. Each contractor must maintain a COVID-19 safety plan at the work site and comply with all city and state orders related to COVID-19. The order also specifies the number of workers allowed on a site based on the type of project and its square footage. For example, with work for 1 and 2 family dwellings, no more than 4 workers are permitted on site at any time per dwelling unit. I also want to note that concurrent with this order, the city's Board of Health will consider new regulations that increase the fines for violations of such activity. Details will be announced at a later date. Complaints about possible violations of the order can be made by calling 311. I would like to thank City Solicitor Marcel Pratt, who has joined us for today's briefing to answer your questions, along with other members of his team. Thanks also to L&I Commissioner David Perry and his team for their work, both on the order going forward, following up when work sites are out of compliance with restrictions. Thanks as well to John Doherty and the building trades, as well as the General Building Contractors Association, for all their work in putting together a separate set of guidelines for workplace safety when construction reopens. These guidelines, in fact, have since been accepted by OSHA as the national standard. As I said yesterday, I'm confident that the resumption of construction activity in Philadelphia will prove to be a much needed boost to economic activity in the city. I'm equally confident that everyone involved will be vigilant about adhering to these safe procedures and protocols as this work resumes. This is just a first step, but an important first step, as we attempt to restart the economy while still doing everything we can to mitigate the spread of this virus. I also want to announce that in line with the governor's recommendations, golf courses in Philadelphia are able to reopen beginning Friday, May 1st. 5 city-owned golf courses and 2 driving ranges will reopen on Friday. This Friday, May 1st, the following city-owned facilities will reopen: Cobbs Creek Golf Course, Carracung Golf Course, Walnut Lane, John Byrne, Juniata, Burholm Golf Driving Range, although the miniature golf will not be open, Strawberry Green Driving Range, also known as 33rd and Oxford Driving Range. To ensure safe conditions, golfers will be required to register in advance, arrive at tee time, and not engage in any socializing. Patrons and maintenance staff will be required to practice safe social distancing, and food concessions will operate takeout and delivery only. Residents can visit Parks and Recreation's website for an up-to-date list of facilities, opening status, and hours of operation. And now I'd like to introduce Dr. Farley for his daily update.
Thank you, Mayor. The situation with the epidemic today is about the same as it was yesterday. There have been 358 new cases identified in Philadelphia residents, bringing us to a total of 13,803 since the beginning of the epidemic. Now, you'll see continued day-to-day fluctuations in that daily number, but it's still looking like we're past the peak of the epidemic and declining, but the decline is unfortunately very slow. If you want to get a better sense of that, look at the graph on our website for a sense of the trends. We're continuing to see clusters in congregate settings where people live together and there's a greater risk for spread within those settings, including nursing homes and behavioral health facilities and the city's jail. We currently have 68 inmates that have active infection in the city's jail. That includes 5 new positives and 8 others who have recovered. We have to report today 25 new deaths from the coronavirus infection, bringing us to a total of 541 since the beginning of the epidemic. A 25 number is similar to the average daily numbers we've seen in the past. Still, if you look at the overall graph on deaths per day, it does look like that's declining. And that was certainly very good news if that does continue to decline. If you want to get a sense of that graph, look at our website. Of the deaths that have been reported so far, 306 or 57% are nursing home residents. In our hospitals, we're pretty much as we were. This morning, we had 1,012 coronavirus inpatients in Philadelphia hospitals and 1,858 in hospitals throughout the Philadelphia metropolitan area. 30% of our general medical beds and 28% of our intensive care unit beds were available. Both of those are about the same as they were before. Those hospitals in the city are busy, but clearly they're able to handle the epidemic at this stage. With the decline in the cases in the community and the stability of the cases in hospitals, we will be scaling back the operation at the Leah Center over the next 14 days. We will be stopping admissions, and then those people who are there will continue to stay there until they're ready to go home, and then they'll be discharged to home. As far as testing, we do have 5 new testing sites to announce today, run by the Public Health Management Corporation and Delaware Valley Community Health. If you look at our website, you'll have information on the schedules for those sites, where they are, and how people can call for an appointment. That's all on our website, phila.gov/COVID. I thought I'd take just a minute or two about the value of testing, because there is increasing interest in testing. We can understand why people are concerned about that and they want testing. But I do want to remind people of the limited value of testing at the current stage of the epidemic when we have so many cases. You know, every year we have a pandemic of influenza. It happens usually in January or February. And we have the ability to test for influenza as well. But for most people, that testing doesn't change the recommendations about how they handle their illness. The same is true for COVID. For people who are non-elderly, otherwise healthy with the infection, the testing isn't really going to change what you're going to do about this illness. And we do need to reserve the limited supplies we have for people who need it most. That would be people in nursing homes or other congregate facilities, healthcare workers, and people who are older, who have underlying medical conditions for whom the infection could be more serious. Now, as the case counts fall and testing becomes more available and we start to do contact tracing, then the testing is going to become more important for everyone else. But at the moment, we're really trying to preserve the limited supplies for people for whom the results of testing is the most value. I'm just remind everybody, the virus is out there. There are many, many cases, so don't catch the virus and don't spread the virus. Assume everyone you come in contact with has it. Assume that you have it, which means keep your distance from people. If you have to go out, make sure you wear a mask. More information at phila.gov/COVID, and medical questions, 1-800-722-7112. Thanks.
Thank you so much, Dr. Farley. We will now go to Armando, who is going to give us the Spanish translation of both the mayor and Dr. Farley's remarks. Armando.
Mensaje del alcalde Jim Kenney para el miércoles 29 de abril de 2020. Buenas tardes a todos. Hoy me complace brindar detalles sobre cómo la ciudad permitirá que las obras en construcción se reanuden este viernes en Filadelfia. Estoy emitiendo una orden ejecutiva que detalla las limitaciones adicionales para la construcción en Filadelfia, siguiendo la orden del gobernador que permite la reanudación en todo el estado el viernes 1 de mayo. Los trabajos solo pueden realizarse entre las 7 de la mañana y las 5 de la tarde, de lunes a viernes, excepto para reparaciones de emergencia. Cada contratista debe designar un oficial de seguridad de pandemia que debe obtener un certificado de capacitación COVID-19 de OSHA, la Administración de Seguridad y Salud Ocupacional. Cada contratista debe mantener un plan de seguridad COVID-19 en la obra de trabajo y cumplir con todas las órdenes de la ciudad y del estado relacionadas con COVID-19. La orden también especifica la cantidad de trabajadores que se permiten en cada obra, tomando en cuenta el tipo de proyecto y su área en pies cuadrados. Por ejemplo, para el trabajo en viviendas para 1 y 2 familias, no se permitirá más de 4 trabajadores por unidad habitacional. También quiero señalar que junto con esta orden, la Junta de Salud de la ciudad de Filadelfia va a considerar nuevas regulaciones como el aumento de las multas por infracciones de los que especifica la orden ejecutiva. Estos detalles se anunciarán en una fecha posterior. Se puede presentar quejas sobre posibles violaciones de esta orden llamando al 311. Le damos las gracias a Marcel Pratt, procurador de la ciudad, quien está presente en la sesión informativa de hoy, junto con otros miembros de su equipo para responder a sus preguntas. Gracias también al comisionado de licencias e inspecciones, David Perry, y a su equipo por su trabajo para implementar esta orden y en su seguimiento si las obras no cumplen con esta normativa. Gracias también a John Doherty y a Building Trades, así como a la Asociación General de Contratistas de la Construcción, por su trabajo para redactar un conjunto de medidas de seguridad para las obras en construcción cuando se retorne su actividad. De hecho, OSHA ha adoptado estas pautas como el estándar nacional. Como dije ayer, estoy seguro de que la reanudación de la construcción en Filadelfia será un impulso muy necesario para reactivar la actividad económica en la ciudad. Y estoy igualmente seguro de que todos los participantes estarán atentos para cumplir con estos protocolos seguros. Este es solo un primer paso, pero un paso muy importante, ya que intentamos poner nuestra economía nuevamente en marcha mientras hacemos todo lo posible para mitigar la propagación de este virus. También quiero anunciar que, de acuerdo con las recomendaciones del gobernador, los campos de golf en Filadelfia pueden reabrir a partir de este viernes 1 de mayo. Hay 5 campos de golf que son propiedad de la ciudad y 2 campos de prácticas que volverán a abrir este viernes. El campo de golf de Cobbs Creek, el campo de golf de Caratung, el campo de golf de Walnut Lane, el campo de golf de John F. Barn, el campo de golf de Juniata y el Barton Golf Driving Range, aunque no se abrirán los campos de golf en miniatura. Strawberry Green Driving Range, también conocido como el 33, y el Oxford Driving Range estarán abiertos. Para garantizar las condiciones seguras, los golfistas deberán registrarse con anticipación, llegar a la hora estipulada y no socializar. Los clientes y el personal de mantenimiento deberán practicar el distanciamiento social seguro, y los sitios que sirven alimentos operarán solo para llevar y para hacer repartos. Los residentes pueden visitar el sitio web de Parques y Recreación para obtener una lista actualizada del estatus de apertura de las instalaciones y sus horas de operación. Y esta es la actualización en materia de salud al miércoles 29 de abril del 2020. Desde ayer se han confirmado 358 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 13.803 casos en la ciudad. Observamos una fluctuación de casos de día a día y al parecer hemos pasado el pico, pero el descenso es sumamente lento. Las tendencias pueden revisarse en el sitio web fila.gov/COVID-19. Tenemos 5 casos positivos de COVID-19 entre los internos, con un total de 68 casos registrados. Hay 8 internos adicionales que se han recuperado satisfactoriamente. Y tristemente, reportamos 25 nuevos fallecimientos en Filadelfia. Un total de 541 personas han muerto por el COVID-19. 308 de ellos, o el 57%, han sido en hogares de ancianos. Este virus no discrimina por raza o por género. 1.012 personas han sido hospitalizadas en Filadelfia y 1.858 personas en la región sureste de Pensilvania. El 30% de las camas en los hospitales y el 28% en las unidades de cuidado intensivo aún están disponibles en nuestra región. El hospital de campaña ubicado en el Yaquar Center cerrará en los próximos 14 días. Las pruebas están disponibles y hay más centros en los cuales se pueden dar en la ciudad. Usted puede encontrar mayor información sobre estos centros visitando fila.gov/COVID-19 bajo la pestaña FAQ. Al igual que con la pandemia anual de influenza, las pruebas no cambian las recomendaciones del Departamento de Salud. Mantenga la distancia social y quédese en casa. Es necesario reservar los suministros para las personas que más lo necesitan. Y todavía hay muchos casos, hay muchas personas infectadas y algunas aún no lo saben porque no presentan síntomas. Hay que asumir entonces que todo el mundo a nuestro alrededor tiene el virus, incluyéndose a usted mismo. Por favor, mantenga la distancia social y quédese en casa. Si debe salir a trabajar o al supermercado, le recomendamos mantener la distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil mantener las medidas de distanciamiento social y lavarse las manos apenas llegue a casa. Solo trabajando juntos superaremos esta tormenta. Quiero aprovechar también ahora para recordarles sobre la necesidad de vacunar a los niños contra el sarampión. Las clínicas y los consultorios médicos están abiertos y están operando. Es necesario reservar suministros para las personas que más lo necesitan. Hogares de ancianos, espacios donde hay gente congregada, los trabajadores del sector salud y las personas mayores de 50 años con condiciones médicas preexistentes. Respecto a la inmunización, quiero recordarles la necesidad de vacunar a los niños contra el sarampión. Debido al COVID-19, los padres no están cumpliendo con llevar a sus niños para vacunarlos. Y nos preocupa particularmente el sarampión. 37% de los niños entre los 12 y 18 meses no han sido vacunados contra el sarampión y debemos impedir un brote de sarampión. Las clínicas y los centros de salud están abiertos. Vacunar a sus hijos es algo seguro y es lo correcto. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas los 7 días por semana al 1-800-722-7112 y esta llamada es gratuita. Gracias.
Thank you so much, Armando. We will now move to our Q&A portion for members of the media. I would like to ask all of our speakers to join us again with your audio and video. I would also like to remind everyone that City Solicitor Marcel Pratt has joined us today for Q&A. And please remember, we do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. We're asking you to please limit your questions to 3 or fewer, and we will definitely do a second round if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your questions if you are able for broadcasting purposes. We will unmute you one by one to answer your questions. And now we will begin with Andy Metzger. Andy?
All right, thank you. Sorry for the backlighting. Regarding the Paycheck Protection Plan, there's been a lot of attention about some of the bigger businesses that have taken advantage of that, but have you learned of any, are Philadelphia businesses getting what they need out of that federal program?
I don't have the list of the businesses in front of me, but I could tell you that most employees work for small business. So some of the larger companies were getting massive amounts of money. It was very disconcerting. Some of them have given that money back, but we can get a full list for you of those that have participated in the program.
Do you have any sense on whether that's been sufficient, that aid, or?
It's never going to be sufficient. I mean, the hit that we've all taken as a nation, as a state and a city, we're never going to make up what we lost. And we're just going to try to do the best we can and continue to work with our partners in Washington to get what we can get out there.
Got it. And then you've talked about a plan for beginning to reopen sectors of the local economy, but do you also have a fallback plan for tightening restrictions in case cases jump up again?
When cases jump up again, well, first of all, we hope to conduct ourselves in a way that cases won't jump up again. And that's why we'll listen to Dr. Farley and listen to the other science-based data that we have. But yeah, if we had to, God forbid, we would have to go back and start over again. And it would be a great loss of life, a great impact on our hospitals, and a greater impact than already had been seen on our economy here in Philadelphia and our government, the resources.
Okay, thank you.
Thank you, Andy. We're now going to go to Max Marin of Plan Philly. Max?
Hi, this is how's everybody? This question is for the mayor. President Trump suggested yesterday that the state and local bailout money from the federal government could hinge on immigration policies in local municipalities. I'm curious if you have a comment on that, considering Philly's status.
Well, it's not legal. Congress would have had to put in specific restrictions for that to apply. He does not have the power to do that himself. And more importantly, it's not his money. It's our money. It's our taxpayers' money. Our people who pay taxes in the city pay taxes to the federal government. It's all the citizens' money. It's not his. It's not like the king in his counting house counting out his money. This belongs to all of us as Americans. And he's not on good legal footing. And Marcel could probably elaborate better than I. But I think it's just a way to make a bad situation worse. We're in the middle of a panic, and not a panic, pandemic that has really gripped everyone. And he continues to need to throw these things out there for whatever political purposes they are. So Marcel?
Yeah, I think the mayor touched on all the right points. We've been through this before with the prior sanctuary cities battle. And if we have to take legal action again, we certainly will.
Okay, thank you both. Another question for Dr. Farley O'Brien or anybody about the Leah Corus Center surge site closing. Do you plan to keep the bare bones of that site set up in case there is another surge? And is this a financial decision in terms of the city wanting to kind of phase this out at this point?
So yes, we do intend to keep some equipment there for one, if there's if for whatever reason we start to see a surge, a return surge of the virus, either as a second wave or just circumstances change. And I wouldn't say that this was a financial decision. Certainly, it does save money. That money we do expect to be reimbursed by the federal government, so that this wasn't about being fiscally prudent, but it was about making sure that we're deploying our resources to the best of our ability. And so some of the folks who are stationed there, specifically our Title X military personnel, may be further deployed into our hospitals and healthcare into our hospitals.
And it was never announced, but do you have a number, Brian, about how much was being spent there to maintain the site?
Let us get back to you, Max,
Yeah.
and we'll circle back.
Okay. One last smaller question. Considering the sort of rolling in of businesses and resuming certain things, has the city considered waiving sidewalk permits at any point so that maybe restaurants and retail businesses could use outdoor space to safely reopen incrementally? Is this being looked at all?
Not that I'm aware of. It's certainly something we can look at, but I think we're a little bit further away from sidewalk dining and restaurant dining than we are from construction opening on Friday.
All right. Thank you, Mayor. Thank you, everybody.
Thank you, Max. We're going to go to Laura Mcchrystal now with the Inquirer.
Hi. I also have a question about the Leah Corus Center for starters. How many people are there currently, and will the new admissions stop immediately? I know Dr. Farley had mentioned it winding down over the next 2 weeks.
I would just have to check. We're either at 5 or 6 patients there this morning. We will allow people to continue to be admitted if necessary over the next few days, but probably early next week, if all continues to look good, that we would stop admissions at that point. Let the people who are still there just continue to stay until they're ready to go home.
And just confirming, there are 5 patients currently.
Thanks. I also have a question about contact tracing. Dr. Farley, I know you had spoken a bit about this a few times last week, but we're seeing, reports of states trying to beef up their contact tracing, and I know Pennsylvania has its own effort. Can you comment on how the city's effort toward contact tracing, would that be separate from the state? Would you work with state officials to trace cases in the city? How would it work?
Well, we would take responsibility for contact tracing within the city of Philadelphia, and the state would be involved in other counties where there are not local health departments. But clearly, these contact investigations are going to cross jurisdictional lines. So we may identify a case who has contacts or residents elsewhere. So we would coordinate with other county health departments or with the state health department around those investigations. We do that coordination all the time in other situations, so that's an easy coordination to do.
Okay, and my last question is about PPE. Can you all just offer any updates on, the city's efforts to obtain PPE? Is there still trouble getting it? Is there, are you still experiencing shortages? Have you gotten any recently?
So we are still experiencing shortages, specifically around N95 masks. We have received, small shipments here and there of various, of both N95s, of surgical gowns, which do seem to be the primary concerns right now. We do have a fairly large stockpile of surgical masks, and I think there is an effort to look at whether decontaminating some of the N95 masks is possible, and would turn to FEMA about whether they have any specific announcements around that.
Thanks.
Okay, thank you, Laura. We're going to go to Argenis Figueroa with Univision.
Hello, good afternoon, Mayor. I would like to ask about.
Starters.
Yeah, okay. I would like to ask in Spanish, okay? Armando, please.
Adelante, Argenis.
Gracias. Quería preguntar qué representa para la ciudad el hecho de que los residentes están desechando materiales de protección personal. ¿Qué medidas está tomando el Departamento del Agua para evitar el congestionamiento de los drenajes?
Esta es la pregunta, ¿verdad?
Sí, son dos. Y la otra.
Does the city think about people disposing PPE equipment and the water supply? What measures are being taken by the water department?
Well, we had part of our talking points yesterday was to explain to people that the problems that disposing of wipes, gloves, wipes, gloves, and other masks down the toilet. It's apparently we'd get 100 pounds of this stuff every year, and now we're getting 100 pounds of it every day. It's creating havoc within, not havoc, but it's creating problems within our water purification system. But it's also going to affect marine life in a negative way. And additionally, it's going to create situations for additional water main breaks that we don't want to see because they're so devastating. So we're continuing to communicate with people this way and in other ways to make sure that they understand that's not what to do. You put it in the trash can and put it out to the curb.
Bien, nosotros lo mencionamos el día de ayer. A la gente los problemas que estamos teniendo con que desechen guantes y material de protección en los inodoros. Normalmente se procesan unas 100 libras por año y estamos teniendo unas 100 libras por día y esto es un problema con nuestros sistemas de purificación del agua, obviamente. Entonces esto puede afectar también a la vida marina y puede llevar a una ruptura de cañerías. Por eso estamos haciendo lo mejor para poder comunicar a la gente que tienen que desechar la basura en tachos de basura en los lugares indicados y no en el suministro de agua y desagüe.
Okay, perfecto, gracias. Otra pregunta sería, ¿qué medidas está tomando la ciudad para proteger a los inquilinos que están siendo amenazados por sus landlords en cuanto a desalojo, aun cuando las cortes no están trabajando hasta junio?
What measures is the city taking into account in order to protect renters who are being threatened by their landlords with removal or expulsion, even though the courts are not operating?
Well, one of the things, and Brian, you can elaborate when I'm done, but one of the things we've been trying to get relative to help from the federal government is help for renters and for mortgage, to stop mortgage foreclosures. We're working on that. We do understand that that's a problem that we're going to face as soon as the courts open up. We'd ask landlords and tenants to try to work together because we're both are in a difficult situation to try to figure out ways in which to pay over time and also do assistance in mortgage foreclosure stuff relative to dealing with the banks and the mortgage holders. So Brian, I don't know if you have any additional.
Armando, do you want to translate that first and then I'll add briefly?
Yes, thank you. Estamos, Brian va a elaborar un poquito lo que nos vamos a responder. Estamos pidiendo ayuda al gobierno federal para poder detener las ejecuciones judiciales y justamente para tratar de resolver este tema una vez que se abran los tribunales. Una vez que tengamos eso, vamos a tratar de trabajar con los inquilinos y con los propietarios conjuntamente para lograr asistencia con los problemas de las hipotecas. Y Brian va a agregar algo ahora. Brian?
Sure. For those people whose landlords take it upon themselves to try and change the locks or force them out of their apartment or their house, a so-called do-it-yourself eviction, those tenants should call 911 because those actions are illegal. And we are taking every step we can to make sure tenants are protected from those illegal evictions.
Para aquellas personas que están teniendo problemas con sus caseros y que están siendo desalojados o están encontrando que les han puesto la cerradura en sus propiedades, tienen que llamar al 911 porque estos actos son ilegales y nosotros estamos tomando los pasos necesarios para poder verificar que esto no suceda.
Gracias, muy amable.
Mucho gusto, Kenny's.
Igual.
Thank you. We're going to go to Pat Loeb of KYW now. Pat?
Thanks, Brian. I'm just wondering what the census at the Holiday Inn is today and whether the new criteria are in effect.
I believe the census today was 82. And yes, the new protocols are in effect, and we expect to see numbers start to increase tomorrow.
Thank you.
Yep.
Is that it, Pat?
That's it. Thanks.
Okay. Thank you. Now we're going to go to Jack Tomsick from Metro. Jack?
Yes, thank you. I wanted to see if you had a number on the total number of patients who have been treated at the Leah Core Center.
I don't think we have that number. We can get it to you.
Okay, because it seems like there's never really been more than a handful of or doesn't seem like it's gotten to in double digits, has it?
I don't believe we've ever had more than 6 patients there at a given time.
Okay.
But if we had problems and didn't have the hospital set up, the hospitals would have been overwhelmed. So better to build it and they don't come than to not build it at all.
All right, thank you.
Okay, thank you, Jack. This is our last call for questions. We're going to go back to a second round. Max Marin.
Hi, just one more for Brian or Dr. Farley. I just wanted to seek some additional clarity on how the city is reporting and will continue to report the COVID cases among inmates in the PDP custody. I just want somebody to explain again why the numbers are being released in the fashion they are with current cases. My understanding is that people who are no longer in PDP custody are no longer being counted as part of the total count, and the numbers seem to fluctuate day by day in a way that seems hard to track, both for reporters and for the public. So I just want to know from the city's perspective why it's being done this way, and if there's another way that you've thought about doing it, perhaps.
We've been reporting the number of people who are currently have the illness, and also how many people are newly diagnosed, as well as people who were removed from isolation, having been recovered. If you want the total number of people who have ever had a positive test at the beginning, we can get that number for you. But just to point out, in the same way that I'm giving you the numbers of daily cases in the community, focusing on the number of people currently infected there, because the number of cumulative cases is only going to continue to go up. We don't have a sense of whether we're making progress, but the number of people currently with the infection, if we're doing well, if we're succeeding, that number is going to go down. So we think it's more meaningful, but if you want all the numbers, they're all there.
Right, I understand that, but in the same vein, you are releasing the numbers, not releasing the number of recoveries for citywide every day, and the number of cases just grows in a way that the public can sort of measure. And I understand the city's position, but I'm just curious if you think that there's perhaps a way that you could release more of the data in aggregate totals online, at least.
Brian, I don't know if you want to answer that.
Yeah, no, I don't have any objections, and in fact, Max, every day I report the number of cumulative cases to our elected officials. So today, the total cumulative cases since the pandemic began is 190 at the prisons, and again, as Dr. Farley said, 68 of those remain in isolation, with 3 that have been hospitalized. If there's some benefit to providing that, I think we're happy to. We think. The reason we're reporting it the way we are is because I think it's important for folks who are worried about our inmate population to understand exactly how many patients are in isolation versus how many patients have cumulatively over time been tested, and exactly understanding how bad the outbreak is in the prisons itself. I think that's what we're trying to get to when we talk about those inmates who are still in isolation.
And you are releasing, last question, I promise. You are releasing people who are COVID positive on a regular basis, pending their discharge from the courts.
Anybody who receives a court order to be discharged, we discharge, and we provide appropriate guidance to them about how they should behave upon their discharge. But we're not in a position to be able to hold inmates no matter what their health status is.
Okay, thank you. Yep. Thank you, everybody.
Thank you, Max. We're going to go to Denise Clay at the Philadelphia Sunday Sun. Denise.
Hi, my question's for the mayor, and it concerns the budget. Is there going to be like a budget briefing like you did with the first budget for reporters prior to Friday's presentation? And is the budget ready yet? Because I spoke to a councilman this morning who says that council hasn't seen it yet.
Well, I don't know. I believe the council president is aware. He usually does the distribution to the council members because he is the president. I believe there is a briefing for reporters that's scheduled
Yeah, Denise, we'll be putting out an advisory about that.
tomorrow.
Later. We'll put out an advisory later today about a briefing tomorrow for reporters.
Okay, thanks.
Denise, did you have anything else?
No, that's it.
Okay, thank you. Okay, seeing no further questions, that will conclude today's briefing. Thank you everyone for joining us, and we will be back tomorrow at 1 p.m. Thank you.